Hello from your local podiatry team. In this video, we're going to take a look at how diabetes affects the feet and show you what you can do to keep your feet safe. Everyone with diabetes should have an annual foot screening. This is because you're more likely to have a serious foot problem that could lead to an amputation. 176 amputations related to diabetes occur every week in the UK. That's one amputation every hour. Most foot problems can be prevented, so keeping a close eye on your feet is vital. Diabetes can affect your feet in a number of different ways. Numbness is caused by damage to the nerves in the foot. This is known as peripheral neuropathy. There can be poor blood supply due to peripheral arterial disease, which is where the arteries begin hardening and become narrower. There can be foot deformity, as clawing of the toes and other deformities are often associated with diabetes. And there is an increased risk of infection. Peripheral neuropathy occurs when the nerves in the foot or legs are damaged. This could result in loss of sensation in the affected areas. It is a common complication of diabetes, and once this damage has occurred, it cannot be reversed. Neuropathy can lead to dry skin, discomfort, pain, and deformity. The loss of sensation makes the feet feel numb, which makes them vulnerable to injury and can lead to a foot ulcer. Poor blood supply to the foot can cause ischemia, which is the name for a lack of oxygen to the skin. It happens when the arteries in the lower leg become narrow or blocked, so blood cannot flow as easily into the foot. This is known as peripheral arterial disease. If the circulation is poor, any injury to the skin may struggle to heal. To make things worse, the longer the injury takes to heal, the more likely it is to become infected. If the blood flow to an area of the foot is completely obstructed, gangrene occurs. This is where the skin dies due to a lack of blood supply. Smoking, high blood pressure and high cholesterol can make the circulation worse. If your leg arteries are blocked, it is often a sign that your other arteries are narrowed, increasing the risk of a heart attack or a stroke. Foot deformities such as bunions or hammer toes can increase the risk of rubbing and blisters. Foot deformity can also lead to corns and callus, which is hard skin, as well as foot ulcers. This is especially true when the foot deformity is combined with badly fitting footwear. Diabetes alters the body's ability to fight infection. This means that not only are the feet more prone to infection, it is more difficult to clear infections once they have established. If you spot any signs of infection such as new pain, swelling, redness, pus or heat, you should seek medical advice from your GP, nurse or podiatrist straight away. Advice for keeping your feet healthy. There are several things that you can do to help prevent problems with your feet. Wash your feet every day, but try not to soak your feet, as this can leave the skin vulnerable to infection. Once you have washed them, dry the feet thoroughly, especially the spaces between the toes. To protect your feet from dryness or cracking, use a moisturising cream every day, avoiding the areas between your toes, as too much moisture here can cause problems such as fungal infections. Check the skin for any cuts, blisters or cracks. Even minor problems could lead to major complications. Take care when cutting your toenails. Always cut to the shape of your toe and do not cut them too short or cut down the sides, as this can lead to an ingrowing toenail. Gently file the nails to remove any rough edges. Do not use medicated corn plasters. Pull off hard skin or use anything sharp to remove the corns or callus yourself. Corns and callus should be treated by a podiatrist. In the NHS, podiatry services do not offer basic routine foot care. If you're struggling to reach your feet yourself, consider paying for a private podiatrist to manage them for you. Footwear and hosiery. Studies suggest that around 70% of older adults may be wearing shoes that do not fit correctly on the feet. Ill-fitting footwear can cause damage to the feet. Make sure that your footwear is long enough, wide enough and deep enough at the toe box so that it doesn't rub against your toes. Feet should be measured to get the correct size. If you have lost sensation, you will not be able to feel if the shoe doesn't fit. Shoes should have a good fastening to help minimize the movement of the foot within the shoe. Lace-up shoes are best, as you can adjust the fit more easily, but Velcro can be a good alternative. Friction and pressure can cause blisters or calluses and corns. Excessive pressure over an area can cause the skin to break down and ulcerate, especially if the circulation is poor. Foreign objects are a common cause of foot problems, so remember to check the sole and the insides of your footwear for loose objects and rough areas before wearing them. If you've lost sensation in your feet, do not walk around barefoot. Try to wear socks or tights with as small a seam as possible, or wear them inside out. Thick seams can damage fragile skin. When wearing socks, make sure they have a soft top which does not restrict your circulation, and that they are not too tight around the toes. They should preferably be made of either cotton, which is better for hot feet, or wool, which is better for cold feet. You should change your socks on a daily basis. What to do if you notice problems with your feet? Do not ignore minor injuries. Make sure that any cuts, grazes or blisters are clean and cover them with a sterile dressing. If they do not show signs of healing within 24 hours, seek medical advice as soon as possible. Be aware of signs that there might be an infection, such as new redness or swelling, new pain or throbbing, the foot feeling significantly hotter than usual, any wounds or breaks in the skin or any fluid leaking from your foot, a new and usually unpleasant smell from your foot, and flu-like symptoms in combination with any of the other signs that we've mentioned. If you develop any of these, it is important that you contact your local multidisciplinary diabetes foot service, podiatrist, or GP for advice immediately. If your multidisciplinary diabetes foot service, GP or podiatric department are not available, and there are no signs of your foot healing within 24 hours, ring NHS 111 or go to your local emergency department. Do not delay if you have a foot problem or are concerned about your foot health. If problems can be dealt with in their early stages, it may prevent them getting worse. Help and advice can be obtained from your doctor, nurse, podiatrist, or pharmacist.